Hello, everyone. So, this is my case presentation. So, the situation is a 47-year-old Caucasian male who was seen in person at the clinic. So, to give some background, his chief complaint is that he reported feeling down, stressed, and overwhelmed due to having two kids under the age of 5, job transition, marital problems, and work-life balance. His psychiatric provider started him on an antidepressant. So this is the first time he's in therapy. He's married to his spouse for 3 years. His spouse is a therapist. He moved from Hawaii to be able to live with his wife here in the Tri-Cities, and his previous job paid significantly more than his current job. His current job involves high stress, so that's the reason why it was starting to affect him. So the assessment is after listening to the intake, I was considering diagnosing the patient with adjustment disorder and grief. So during the first follow-up, my preceptor shared the patient's official diagnosis. So depression unspecified and adjustment disorder with depressed mood. So I agree that the patient exhibits adjustment disorder with depressed mood, especially during the intake because the patient started to cry when he was talking about the death of his brother. So my recommendation would be the patient discussed wanting to find a compromise between what his wife wanted and what he wanted. So his wife wanted to spend more time together, and he was willing to talk for 30 to 45 minutes before he went to sleep. The patient discussed wanting to be a good dad and not losing his temper with his kids, especially when they're rowdy. So my preceptor was discussing how this is a good thing that his kids are unruly and excited to be home because it means that his kids feel comfortable being themselves while at home. So I noticed the patient agreed with this statement, which changed how he looked at the situation. So what my preceptor uses is solution-focused brief therapy. So solution-focused brief therapy from my preceptor standpoint lasts from 4 to 6 months, and sessions are usually 45 minutes long. So my preceptor always performs the GAD-7 and PHQ-9 at every visit. So for the patient that we just discussed, his GAD during the follow-up visit was 3, and it was previously 7, so it actually decreased, and the PHQ was 5, so it stayed the same as the previous visit. My preceptor emphasized the importance of having the patient develop a solution. So, for example, the patient came up with the idea of talking to his wife for 30 to 45 minutes before he goes to sleep. My preceptor applauded the patient for choosing psychotherapy, especially when it was the patient's first time. And then my preceptor asked the patient what he values because he discussed what his wife wanted during the first follow-up, but my preceptor really wanted to know what my patient wanted. So, the first question that's part of the self-reflection is what could you have done differently and why? So, in this situation, I mostly observed, but I was expecting to hear more about the death of the patient's brother because that was a pivotal point during the intake. So, I was actually surprised that he started talking about experiencing marital problems. But this is one of the reasons why I appreciate my preceptor's approach of asking, how's everything been? As the opening question for each session. So some internal reactions that I had was thinking, this is a difficult situation, but I know what it's like to struggle with balancing work and life. Because I've had these type of conversations with my girlfriend about how she wants to spend more time together. And just like my preceptor discussed, it's about compromising. And then I was also thinking during the session, why don't they just talk, like the patient and his wife after they both get off work? An external reaction that I was having was active listening and then head nodding, because like I said, I only observed the session. So how will you address this for future interactions or similar clients? So in my opinion, it's okay to provide personal experiences, but only if necessary. It is crucial to keep the session patient-centered, so focusing on what the patient wants to talk about and their experiences. Sometimes we like to talk about ourselves to relate to others, but finding the middle ground between sharing personal experiences and keeping the sessions focused on the patient is pretty much the critical point. So what did you find surprising about this patient? So after observing his intake, I wasn't sure what to expect. I was surprised he opened up as quickly as he did. As I said earlier, I was surprised that he talked about marital issues during the first follow-up visit. So what considerations are you giving to the patient's social determinants of health? So the patient reported that his current job significantly pays less than his previous job in Hawaii. It wouldn't be a bad idea to ask if he has trouble paying for things. The patient reported that his wife is a therapist and he has two kids under the age of 5, so he does have quite a few financial responsibilities. However, the patient reported recently going on a cruise, so it may be safe to assume he is financially stable. Since he was originally from Hawaii, he may have needed resources regarding the Tri-Cities. He talked about not having too many friends in the area, so he may benefit from resources discussing activities in the Tri-Cities. What considerations are you giving to the patient's cultural needs? So he was originally from Hawaii. So does he follow Hawaiian cultures? Maybe he eats certain foods, but he doesn't know where he can find those specific foods here in the Tri-Cities. Perhaps he has certain hobbies in Hawaii, and providing him with resources about the Tri-Cities would be beneficial. Lastly, in what way can you tell that you're thinking in the level of an ARNP and not an RN when caring for this patient? So as a future psych mental health nurse practitioner, I have to decide how to diagnose a patient. That's one of the reasons why earlier I was talking about what I would diagnose this patient with. I've always thought about what medication I would start patients on and why, which is different from being a nurse. In addition, I've learned about the different therapeutic modalities, which I didn't really know about as a nurse. Since my preceptor utilizes solution-focused brief therapy, I've been practicing that specific therapy with the patients we see. However, I have considered how helpful other forms of therapy could be with certain situations. Thank you everyone for listening to my presentation.